afraid we have to start again. We just have 40 more slides to see. Now, the purpose of this explanation of what the Chinese call gui, which has always fascinated me in Chinese psychology, and actually today, in modern days, it has a lot of sense because it falls into what we can tell as subconscious manifestations, especially developed by Freud and then Jung, that dreams were a way of expressing what was not expressed. And this the Chinese have mentioned, dreams are the domain of the Hun. Hun is responsible for also releasing the internal accumulations and especially emotional accumulations. And one of the important aspects of dream work, which unfortunately we will not cover today, but it has been, I have sort of developed it in the book, is also to be able to address people's problems, complaints, which manifest symbolically through dreams. There is a lot of work today done, mentioned before, the limbic system, which also has the memory and it has the sort of the relation to emotions, the amygdala and the emotions in the brain. And dreams are, in a sense, enacting situations to allow the person to live through it's like watching a film where the actors are playing out a scenario and emotionally we participate and we are affected. So except that this is our own internal film and we know exactly what is the emotion we are trying to release. So in a nutshell, when we are analyzing sleep and when patients talk about, one of the questions I always ask if they remember their dreams, and if they do, if they remember certain themes which come back, and of course nightmares, and nightmares are very significant. But the dreams which come back, it's not so much important the theme of the dream. Of course, for people it's very interesting, this happened, that happened, there was this, there was that. But what was the last residual emotion? The person woke up feeling what? Sad, afraid, happy, whatever. And normally we say in Chinese medicine that a balanced, for example, person has the 5 colors, that a balanced meal has the 5 tastes, and a balanced dream has the 5 emotions. It's a good film. It has a happy ending, and people wake up. I don't remember the dream, but I feel good. So, no problem there. But if there is a residual emotion, that emotion can guide us then towards the system that we need to treat. And as I have not covered it in this expose, but it's a whole way of working with habitual or recurrent emotions with patients. I use a lot the back points which deal with the spirit, with the will of the organ. You know, bladder channel has a parallel branch, the outer bladder channel, and there are basically 5, actually for me 6 points. I include the Gao Huang Shu, bladder 43, which probably is the most important one. So we have Pohu, bladder 42, bladder 43, the Shentang, bladder 44, and then the Hunmen, bladder 47, and the Yizhe is bladder 49, and the Zhe point, which is bladder 52. These points tell me a lot. I use them diagnostically by palpation and therapeutically, as well as the back shu points. And of course, there's a whole procedure also using distal points where when the emotion is an excess type or coming from deficiency, the approach is different. That's unfortunately out of the scope of today's talk. We stay more with sleep problems. Now, as I mentioned before, in the substance approach, blood is a very important substance, and because blood houses both Shen and Hun. It's sort of the material residence of Shen and Hun. So when blood deficiency is there, or whatever disturbs blood will disturb Shen and Hun. So deficiency, of course, is the main one. And we know that in blood deficiency, one of the common complaints is, first of all, waking up frequently. Of course, having difficulty falling asleep, waking up frequently, and also dream-disturbed sleep. And what is very common with blood deficiency is that the dreams become very vivid and very colorful. We often speak about colorful dreams as opposed to black and white dreams. The colorful dreams is usually relating to heart blood, whereas black and white relates to the kidney. Now, the Hun also, when it doesn't have a physical residence, the blood, will wander more easily, and of course the person will have more dreams. Not necessarily nightmares. Nightmares are really manifestations of fire. We know heart fire or liver fire more easily cause nightmares. Another aspect of liver blood deficiency would be physical restlessness, because muscles lack blood, and therefore there's going to be a disbalance between blood and qi in the muscle. Muscles tend to spasm up, so there's going to be physical restlessness. Whereas with heart blood, it's more mental agitation. So these are the sort of guidelines. And of course, organic disturbances that produce emotions will affect also the sleep, because all emotions ultimately affect the heart, as it's mentioned here. Of course, anger will affect the liver, produce liver fire, and liver fire will produce heart fire. Joy and sadness affect the heart qi, because they, for example, joy directly scatters the heart qi. Joy, we are talking about excessive excitement, not real happiness. Happiness is the emotion which harmonizes all the other emotions. So we're talking about excessive excitement. It's what, for example, we see children when they're having fun with the computer games. That's not joy. And we see that it's excessive, and it scatters the qi. The same way as sadness blocks the qi in the chest, affects the lung, and will affect heart qi. Worry, of course, stagnates the qi in the spleen, and it affects the production of blood, and therefore heart blood is affected, and so on. You can see very clearly that each emotion is affecting the corresponding organ, but ultimately is reflecting on the heart. And of course, they will affect the You have many squirrels in the park. I'm sure if you look well enough, you'll find some of them sleeping like that. Now we come to a little bit complicated part, to relate the extraordinary channels and make them give us information about the structure of the sleep which is disturbed. Now, first of all, there is a presumption, and that's my personal presumption. I take full responsibility, is that the quality is reflecting on the Wei channels and the quantity of the sleep on the Qiao channels. This point can be debated. We had Master Jeffrey Yuan lecturing about the extraordinary, and for him, quality and quantity were reflected on the yin and yang Wei. So he had a different understanding of the system. My understanding, as I mentioned it before, is that Qiao channels seem really to indicate something rhythmic to do with time, this day and night business. That's why I've gone one step further. So I say that time is reflecting on the Qiao, and that, what else is there? And of course, the two together, yin and yang Qiao and yin and yang Wei, are going to regulate the space and time. That means the amount of activity during the day and sleep during the night. And basically, we have seen if the time is reduced, I have some diagrams later that explain this. If the time is reduced, that means a person, let's say when we interrogate them, they have difficulty falling asleep. It takes them an hour to fall asleep. So they have lost 1 hour at the beginning. Or they wake up in the middle of the night, or they wake up too early. We can say the time is reduced, and we can presume that it's the Chow channels which are regulating. If it's the space, that means the quality of sleep. Person says, I fall asleep deeply, but then in the middle of the night, I toss, I turn, maybe the person is sweating, maybe they have to get up to go to the bathroom, and then they cannot find their sleep again. Or end of the night, the sleep is disturbed by dreams, by sweating, by muscle cramps, whatever. So we can say the quality is disturbed. It would reflect on the wake channels. So what we can say is that insomnia either is defined by length, which is less, or quality, or both. And what I can tell you is that anybody who's had a long-standing insomnia, a good chance is both parameters are disturbed. It's rare that you will just find the person for 20 years has had the same problem. Usually what they say, I fall asleep, I sleep 2-3 hours, and then my sleep quality is poor, I toss and turn, so the quality is bad, and then I wake up at 4 in the morning and I cannot find sleep anymore. Here the length is also disturbed. So you can see very well that they actually sleep maybe 2 hours or 2.5 hours of a good sleep, and the rest is poor sleep. So it's very important to define that. Furthermore, everything in Chinese medicine is subdivided to 3 sections. So obviously, we know the 3 sections of the body, arms, legs, the 3 intensities of yin and yang. We know the number 3 plays a very important role in the dialectical systems. And therefore, the sleep time also is subdivided into 3 parts. So we have initial, middle, and last phase of sleep. And this division, obviously, we do it individualized to the person's sleep time. If they are sleeping, let's say they say, my sleep time is 9 hours, so they have sections of 3 hours. If they sleep 6 hours, it's section of 2 hours. So we subdivide and adapt to the person to analyze the next stage. So we can say the type of insomnia, basically, this is a normal condition. We can say that the wake time energy corresponds to what the person has reserved during the night, which means that they do whatever they have to do during the day, and they have enough energy to finish the day and arrive at nighttime. If they run out of energy, obviously it means that they did not accumulate enough. So here, if it's reduced time, quantity is less, and we can say that this condition reflects on the Chow channels. I remind you, this is my personal presumption. So it's one way I'm using the extraordinary, does not engage any of the other traditions. If the quality is disturbed, for example, in sleep apnea, snoring, frequent dreaming, night sweating, whatever, the quality is disturbed, the sleep time is normal, but the person is tired upon waking. The key is, how is your sleep? Doesn't say anything. We ask people, I have a whole interrogation method, asking about, first you say, how is your sleep? So open the door, and they tell you. If they say it's okay, the next question is, how do you feel when you wake up in the mornings? Do you feel lively? Do you feel, and it's also a sign, you remember, a sign of depression is people don't want to get out of bed. They don't feel good. So that also is an indication, might be a problem with sleep. So here, the quality is affected, and when the quality is affected, for me, it's the yin or yang way. Why I have put the yin first is because, of course, we are talking about the yin times at night. But of course, yin and yang way, like yin and yang chao, they work together, and if one is disturbed, the other one automatically also is disturbed. So the problem for sleep could be the yang way, although more commonly it is the yin way. Now, one thing where the way I also ask, when you are awake, what is the state of the mind? It's very important to define. Are you wide awake? It's like you read a book for an hour and a half before you fall asleep. That means the mind is awake. It's active. You watch TV, you do computer work in the middle of the night, that means the mind is active. Other times people say, my mind is too tired, my eyes are too tired, I cannot concentrate to read, but I cannot sleep either. That means here, the mind is not clear. Or you wake up and you think, but your thoughts are clear. For example, you wake up and you're planning your next day and you're planning your next move and your whatever. It's a coherent thinking process. The mind is clear. Or you wake up with all kinds of nonsense running in your head. Like the radio, you cannot shut it down, and there's all kinds of, and then even if you worry, but then the worry, you find excuses to worry about. You know, we are very creative. You find something to worry about, and then that keeps you awake. And then as soon as you've solved that problem, you find another one. Right, we can always find another worry that concerns the worry. So that would be the mind is unclear. So that's how I define clear mind, unclear mind. And then are there physical symptoms? Is the body relaxed? Or on the contrary, is the body tense? People need to move, they need to get out of bed, they have to go put cold water on their legs, calm down, send the wei qi, move the wei qi, etc. And then once you've divided that, now again, please, I'm just giving you this as an indication. I don't expect you to understand right away the system. It's a bit complex. Because first of all, we are not used to thinking of the extraordinary in this manner. And secondly, to analyze it in this way. So I'm giving it to you as a supplementary tool. You don't have to use the extraordinary to treat sleep problems. Already the first part with the approach, Wei Qi and blood and Shen, you're going to do a lot of wonderful things. Plus you have the patterns, the classical TCM patterns. Now, with the sleep, the temporal segments is going in time. Yin is first Shao Yin, then Tai Yin, then Qiu Yin. This is, if you see the terminology, what it means. Shao is small. We are born little. We grow up, Tai. And then we get old, Shui, end. So that's the evolution in Yin, Shao, Tai, Shui is in time. Whereas in space, it's different. So when we are talking about quantity, somebody having difficulty falling asleep, it will reflect on the Shaoing. What is the interest of this approach? What is the superiority of this approach as opposed to a Zhangfu approach? In Zhangfu, you say, okay, you analyze the pattern, you find the person has heart blood deficiency, you don't need to know that it's a Shaoyin case. It will tell you that the beginning of the night will be the most difficult part. People say, I have difficulty falling asleep. All right? This is another way, another approach. I don't ask about the Zhangfu. I approach them from the extraordinary. And the extraordinary will lead me to Shaoyi. The advantage is the choice of points I'm going to make depends on the section of the night which is disturbed and the channels that I've discovered to be disturbed. So here, in this case, accidentally, heart 7 would be, of course, the choice point. In this case, they will respond very positively to, for example, in Shaoyin, heart 7. But if it's the middle of the night, Tai Yin, And Tai Yin, you will choose Tai Yin points. And if I've given you lists of points at the end of your handouts, you will see classification of acupuncture points affecting sleep according to the channels. And if you go on the Tai Yin channel, you'll find spleen 1 is wonderful, you find spleen 6 is one of the classical points, etc. You will find on the spleen channel there are specific points that are beneficial for sleep. Then selection will be made from that. And Tai Yin also is lung. And we see in the lung channel, for example, lung 1 is a major classic. Lung 1 for waking after 3 in the morning, classical indication for lung 1. And then, if it's the quality in space, the yin is organized according to the disposition on the body. We have Tai Yin, Qu Yin, and Shao Yin on the body. Don't mistake the disposition in space with the order described in the Shanghan Lun. Herbalists often have a difficulty with this one, because in the Shanghan Lun, the yin is first Shao Yin and then Qu Yin. Whereas on the body, from outside to inside, what we have is Tai Yin, Qu Yin in the middle, Shao Yin the deepest. Tai Yin, Qu Yin, and Shao Yin kidney channel is very close to the center. On the leg, the same. The disposition in space, that means from outside to inside, goes Tai Yang, Shao Yang, Yang Ming, Tai Yin, Qu Yin, Shao Yin. So we use this order in the dealing with the quality of sleep. And if you are familiar with the Yin Wei, the sequence of Yin Wei, we know it starts with kidney 9, and then it comes to the abdomen, and it has several spleen points, Tai Yin. It goes through liver 14, Qu Yin, to end at Ren 23, the knot of Shao Yin. So we see that the sequence of Yin Wei is clearly indicating the 3 phases of Tai Yin, Qu Yin, Shao Yin. And in the symptoms of Yin Wei, we also have the typical heart pain described in the classical text as a pinching pain, as a transfixing pain, and as a stabbing pain, indicating the 3 levels. Shao Yin, the deepest level, is giving a stabbing pain, the most intense pain. So that's another thing, but again, it's too much information at this stage. Now, to make life simpler is, have I given this? Yes, the diagnostic confirmation. On slide 33, I've indicated, okay, this is a parallel with different sleep stages. At this stage, I've given it for information. I don't want to spend too much time on it, but more I want to emphasize the diagnosis of insomnia. So if the initial stage is disturbed, you ask them which part of sleep is disturbed. Let's say, simple case, I have difficulty falling asleep. I toss and turn, or I read a book, or whatever. It takes me 1.5 hours to fall asleep. So it could either be a problem of quantity, time, Qigong, or it could be a problem of quality, Wei. You follow? So it's either one or the other. What makes the difference? How is the mind? Mind is clear, active, so it's a problem of time. Mind is not clear, it's tired, I cannot concentrate, I cannot read, etc., etc. Or some people say, I fall asleep, but I have an impression of being awake, which means you're staying in N1 sleep. And there are patients we've had in the sleep laboratory. One thing which is very interesting is that there's a discrepancy between subjective and objective sleep. That means you could feel like you didn't sleep at all, and yet the machine showed that you slept 4 or 5 hours. So there's a discrepancy. Or you could say that I had I woke up and I was awake for 1 hour in the night, but the machine shows that you just woke up a short time but went back to sleep. What this tells us is that the quality of sleep was very superficial. That's why you were believing that you were awake. Discrepancy between objective and subjective sleep. So that's important as much as possible to analyze if we can, from just interrogation, come to a conclusion. But as this is not simple, I've given you some guidelines how to do that. As it's not so simple, there is a simpler way. One thing which is missing I find in a lot of acupuncture textbooks or acupuncture education is the significance of painful points on the body. I mentioned earlier that what we have, the tradition has said back shu points and front mu points have a significance. That palpation of chi cleft points has a significance. That yuan source points have a significance. Most of the systems of the body reflect on a painful point. And they have not been analyzed, classified, or indicated. And it's an unfortunate state. There was an article, I think Peter Dedman wrote it some years back, the importance of palpational diagnosis. I think it was in the Journal of Chinese Medicine. He mentioned the importance of palpational diagnosis, but at the end, from the classical text, what do we have? 3 points, 4 sets of points? And we have all so many systems. But they have indicated points. Every system has a diagnostic point. And they have indicated for 4 extraordinary channels, chi cleft points. Now, what are chi cleft points about? Chi cleft means what? The energy can get obstructed. So 4 of the 8 extraordinary, the tradition has indicated they can get obstructed. That means they can dysfunction. And it happens that it's the 4 which interest us. And these are the chi cleft points. And when we have a suspicion, okay, for example, somebody has difficulty falling asleep, they read the book, so the mind is clear. I suppose it's the yin chao, which is disturbed. So I immediately go and palpate kidney 8 on both sides. It's an immediate confirmation. And if kidney 8 is not sensitive, I palpate the yang chao points because we know they work in complementarity, bladder 59. It takes us less than 10 seconds. I usually do it, I put 2 fingers there, happen to be almost on opposite side. So while one finger is pressing kidney 8, is it sensitive? And the other one is pressing bladder 59, which one is sensitive? And immediately I have information, confirmation, or it doesn't respond or give me a clear clue, but at least when it does, I have a second confirmation. I have the theory and the sort of the hands-on confirmation of this disturbance. I use these a lot, and especially they become more valuable when a person comes with a recent insomnia and does not have any Zangfu disharmony patterns. And I promise you there's a lot. Don't you get some patients who are so annoying, they have nothing wrong with them? I have a young guy who comes with he's had a change of job, and I mean in his job he had a change of thing. He was promoted, and now he has a lot of people under him he has to manage. And since then he's developed insomnia. So great, he's got an improvement, and then he has an insomnia. And he's sportive, he's young, he does regular sports, he does nothing on the tongue, on the pulse to really go with, the pulse is a bit wiry, but who isn't, a bit stressed. So what do? There is a new change, his hours have changed also. He has to get up earlier, and of course he has more work on his things. I just went for the chi cleft points and regulated yin and yang chao. the simplest treatment you can imagine. I palpated the points, and I found that one side, bladder 59, was more sensitive. So I did bladder 62 on that side, the key opening point of Yang Chow, sedated bladder 62. I tonified kidney 6 on the opposite side, and I just did yin tang. I would have done bladder 1, but first session, I never do bladder 1. I want patients to come back. Just 3 points, regulating the yin and yang chow. Saw him a week later, said, I'm sleeping, perfect. There's no need to treat. But he made an appointment, so I did a few points there, I know. 4 barrier stuff to just do something. I wasn't going to send him home. I said, call me back if it comes back, and he never did. It was, that was it. But this is a nice story, ends well. These are sort of stories we remember and wish more patients were in this situation. More people are much more complex. So this is I advise you to use the Schick left of these 4 channels. And of course, I usually treat always one side. The extraordinaries, I just do the key opening point. There are many methods. Machocha always uses it with the complementary key point. I don't think it's necessary unless there are specific, for example, in a menopausal woman who's having hot flashes and night sweating and has sleep problems, and I have discovered that kidney 8 is sensitive on the right side, I will do kidney 6 on the right. In her case, I will complement with lung 7 because we also need to support the C of yin, the renmei, because she, in her condition, she has symptoms in that direction, but it's not systematic. So that, for me, it's like you choose from one case to the next. Now, as an example, here is, for example, the yin wei and the sequence of yin wei in space. So we know it's tai yin, shui yin, shao yin, the yin wei. And when the first segment is disturbed, there is insomnia in the first section of the night. But remember, this is the quality which is disturbed. So the person worries, there are a lot of emotions going around, maybe physical symptoms are present, maybe there is some restlessness. So you can see that it's not a quiet insomnia, it's a restlessness. The quality is disturbed. When the second phase of the night is disturbed, the symptoms will occur in the middle of the sleep. So maybe around 2 o'clock, people wake up, or they have cramps, or they might have restless leg syndromes, or a lot of disturbing dreams, which keeps them awake. When it's the end of the night, the person will have restlessness, sweating, maybe anxiety attacks, maybe even fearful dreams, something which disrupts the sleep at the end of the night. Now, in all 3 cases, your Schick left point, kidney 9, Jubin, will be reactive. And this will indicate that yin wei is disturbed. I've taken the simplest example, and in this case, pericardium 6, neg 1, will be maybe complemented by the Gongsun, spleen 4, the Chongmei, key point, maybe complemented. Otherwise, I usually just do pericardium 6 with possibly kidney 9 on the side that it was painful. Now, maybe the problem is not the yin wei, but yang wei, which, as I said, often complements yin wei. And then, as you can see, I have given an example of choice of points. For example, it's a tai yin stage. I've used points from the tai yin. Spleen 13, 14, 15 are actually the abdominal points of yin wei. Maybe one of them is reactive. Maybe the person also has bloating in the beginning. They go to sleep. They feel full in the belly and they feel bloated. And then spleen 15 would be interesting to use. Spleen 1 is one of the classical points given for insomnia, together with stomach 45 or dream disturbed sleep. Remember that those are sort of classical combinations. And then I've added stomach 45. It's not Tai Yin, it's a Yangming, but it's coupled with Tai Yin. So that's sort of a choice of points appropriate for the Tai Yin phase. For the second stage, of course, liver 14, and I mentioned gallbladder 2 before. It's given in Soulier de Mohan as a point affecting sleep, and people say they're waking after 3 in the morning. Gallbladder 12 is one of my very favorite points. I remind you that in modern China, they developed a lot of points for sleep, and they had all these names. They had Anmian, and Anmian 1, and Anmian 2, and then I don't know what else. All of them, when I did some research, the description of the points wasn't very clear. They're all of them around the area of gallbladder 12. And gallbladder 12, I always say, is sort of the poor cousin of gallbladder 20. Everybody uses gallbladder 20, and people forget the importance that gallbladder 12 has on relaxing, first of all, the occipital barrier. The energy often gets blocked in this area, and gallbladder 12 is one of the fabulous points. It controls also the sternocleidomastoid muscle, which is a major holding muscle. There's a lot of holding that occurs. It's one of the 5 muscles which control what we call the wushu, the 5 axes of the body, and it's the junction between head and chest area. So you see the importance that this point plays on many levels. Plus, of course, it's a point which belongs to wood, gallbladder, liver. And then for the last phase, insomnia of the 3rd stage, of course, kidney 9, or Zubin, is one of my very, very favorite points because of its wide range of indications. Of course, it's very well known to midwives and to people working in obstetrics. You remember the point that's given to do during the 3rd, 6th, and 9th month of pregnancy. But also, I find it a fabulous point for many other things because it's the starting point and Shiklev point of Yin Wei. And Yin Wei is the binding of the yin. It sort of regulates the inner milieu. So it has a lot of importance. And of course, the knot of Shaolin. The knot points also are dating from the time where acupuncture was mainly acting on the channel system, and they believed that all the channels were moving inwards, and they were concentrating on certain points on the body, which we call the knot points. And the principle of root, knot, and branch therapy on the channels today is somehow a little bit forgotten. It's a pity because I use the knot points for diagnosing levels and also for treating them. The knot of yin, all of them are on the renmi. So that's an example. I've given you the diagram, the same for the other sections, but again, I don't want to spend too much time. As I said, this is a bit a difficult chapter to digest and swallow in such a short time. So here, the quantity of sleep is disturbed, so we are more concentrating on the yin chao mei. And of course, again, the selection of points, as you can see, is made according to the level which is disturbed. One thing which we will talk about, maybe, no, at least I've given you, I would like just to mention is that the kidney channel, remember, the axis of Shaolin, the balance between water and fire, is a very important aspect of sleep. And one of the major symptoms of this pattern known as heart and kidney not communicating is the disturbance of Shen, manifesting, of course, as insomnia, sort of one of the major cardinal symptoms. So that is a very important aspect. And all of the kidney points on the chest have an action on calming the Shen. And unfortunately, there are many harms that have been done in modern TCM. We had a discussion during the break. One of the harms was, remember that TCM is traditional Chinese medicine, and it's not even 100 years old. So I laugh sometimes when we say traditional Chinese medicine. TCM was a word that was invented during the communist China, when all the Chinese doctors were trying to upgrade the Chinese medicine, and they forbade the use of old traditional Chinese medicine or old Chinese medicine in favor of modern Western medicine, because at that time the Maoist movement was towards communism, and the communist regime did not believe so much in all these old, what they termed as accumulated garbage of centuries, all these belief systems. So they tried to get rid of it. And people actually came in the streets. They had a manifestation to support. They wanted to keep their medicine. They didn't want Western medicine. So they came up, and Mao, in a very famous discourse, called Chinese medicine a treasure house. And all of a sudden, all those young politicians who were trying to be holier than thou, and they were sort of closing down all the acupuncture clinics, they turned their jackets, they say, yes, it's a treasure house, we have to save it. And that's where they termed it traditional Chinese medicine as opposed to Western medicine. But then you couldn't keep traditional Chinese medicine and talk about Shen, Hun, and Po, spirits, about Gui, about all these things. So there is a fabulous book, if you ever get to read it, by somebody, Kim. He did a dissertation on the history of TCM, day to day. It's fabulous. Every day a military doctor would say, yes, but all these channels, they don't make sense, they're so crooked. So I saw actually a channel chart, where the channels were all straight lines. And the channels were made in squares like this, like you would dispose of military things, borders or military lines or whatever. There would have been Napoleon would have done the same, straight lines. And then another one would come up with something else. And then I had discussions with some Chinese doctors who were educated during that period, and we discussed about emotions. And I swear to God, the Chinese guy got angry. He says, this is all Western nonsense. Emotions, he didn't say emotions don't exist, but emotions don't cause disease. I said, but it's in the classics. They say internal causes are the emotion. He says, no, that's old belief. We don't believe in that anymore. We don't have spirits. It's chi and blood. So you see the shift to Westernizing your thinking, and even this aspect. And of course, they got rid of a lot of stuff there. It lost its impact. The first TCM books, they had 14 channels, and that's it. There was no mention of all the other channels. Then, if you have ever seen that, the first TCM book came out in English and French, and it was a propaganda. It was very cheap. For 10 francs, we were buying this fabulous book in color. It was the cheapest book on the market. Very simple. And then, of course, they redid the re-editions of that book, and then slowly, now with the West talking about the Jingbie, and then the extraordinary channels, and all these wonderful things, and now, of course, the Chinese are getting offended. It's their tradition, and they've lost it, and now they want it back. And there was 2 years ago an article published in a Chinese journal. A friend of mine told me about it, and this article was published by a professor of Chinese medicine who was mentioning that our young students in Chinese medicine should pay more attention to the classics, to the classical texts. And in a sense, what he was criticizing, the education system that had put aside all the ancient stuff and sort of gone into the bare TCM stuff. Now, all this to tell you that TCM has stripped naked classical Chinese medicine. So I'm, of course, you might notice, sort of defending classical Chinese medicine, and especially a lot of the classical texts and mentions, maybe they were not clearly stated, but today we have the possibility to experiment. I mean, that doesn't cost us much to experiment with things. And one, of course, will be to work with the extraordinary channels. Somebody was asking if these things are in the book. In the insomnia book, I mentioned, I don't go deeper into it. There was a need to speak about the three traditions and acupuncture channels and acupuncture points. This is a work I've done for now maybe 15, 20 years, and I was using it to teach. I was not thinking of making a book, especially, first of all, the Khafaji and Deadman's book came out, and I said, well, who wants to write a book after that? I mean, they have completed the circle. It's wonderful, and you know, I looked into it. There was a lot of classical stuff, but it was missing the oral tradition and the European tradition. Then Giovanni's book comes out on channels of acupuncture. He's talking about all the secondary channels from a TCM angle. Again, it's missing. And somehow then I said, okay, you know, one last effort I'm going to do is do that. And in that I called it Bridging the Gap. It's now in edition, should be coming out soon. Was supposed to come out by September, but I think it's taken a few months delay. It's called Bridging the Gap, Channels and Points of Acupuncture. Not very original. Not many editors were interested because it's like, there are 100 books on channels and points. What's the difference? Basically, what I've tried to do here is to bridge the gap. The classic, the traditional, and the European, and the oral tradition. So I've started a lot of research and compilation. And then using all the secondary channels and explaining their roles and places, and also with a lot of clinical examples. It's important, so you see how to use them. Of course, there I have detailed the extraordinaries much more than in the insomnia book. Now, it's a classic. That's a classic. Now, obviously, as I mentioned before, this is in a resume. To analyze insomnia, we try to define the segment of the night which is disturbed, and then what kind of disturbance is it? Is it calm insomnia or restless insomnia? And if there are somatic symptoms, like we saw before, and then which section, initial, middle, or end of the night, and then we palpate the 4 Shiklev points. So in a nutshell, this is roughly the approach. And then once we have defined the section of the night, which is disturbed, let's say we say it's the middle of the night. The person is having a disturbed sleep. The mind is not really clear, so it's the quality which is disturbed. Quality means it's the Wei system, and Wei in the middle of the night will correspond to Suyin, right? Suyin, we have liver and pericardium. So you see, we are coming from the back door to a Zhangfu disharmony pattern, then asking a few questions about liver and pericardium. We didn't start with that. Now, if your habit is to do Zhangfu disharmony patterns, you start with that. Why I opted for this system is because in many cases we don't have a clear pattern to go with. In many cases, like this young man, if I had gone with the pattern he was presenting, I wouldn't be able to treat him. He had nothing. So I would have ended up doing what? Shishen Chong, Shenmen, and Sanyin Zhao. Sort of this eternal recipes. I had a student who went to China, did 3 months of work there, came back, and he said, you know, all this thing you said about insomnia and sleep, forget it. In China, they all do Sicheng Chong, that's all. But they do every day for 10 days in a row. We call it a course. They stop 2 days and do 10 days in a row. That's another way. I mean, it's okay if you don't mind working like that. It's okay also. You just keep doing. And then I said, and all your patients respond. He says, no, after 2 courses, if they don't respond, 2 courses means 20 sessions. If they don't respond, then I do anamnesis. Then I do diagnosis. Oh, I said, well, do the diagnosis first. My contention is, if we personalize our treatments, we don't need so many sessions. And that's one thing, when I came back from China, I was embarrassed. How to do the same protocols that I had done in China, I cannot do them here. Nobody comes every day for acupuncture. I cannot repeat the treatments. Oh, okay. How much battery do I have? No, I have a wire. I guess I can. It's okay. We finish in 10 minutes, no? Yes. 15 minutes. Okay, I have enough battery to finish that. Okay. It doesn't want to continue. It refuses. Now, the following slides, we will not comment. It's yes? Oh, you're just stretching. There are just a review of the different stages with examples of points. So that's for you in case you want to use the system. So that's, and then this is an indication because, as I said, we have abused and overused Shenmen. In Chinese, they actually have 3, if not 4 strategies for the mind. And they have different names, and in herbal medicine, they actually represent different categories of herbs. You brought an... I have one, so it's okay. I think we managed, but in case, it's okay. So just this is a little reminder that there are actually 3 terms, An, Qing, and Ding, for the mind. And you can see that basically Heart 7 can almost be used in many of the situations, but it might not be the ideal. And one thing which, when I read the first Machocha book, Fundamentals, and he mentions about pericardium 7 being a better point for women to calm the Shen. And I used it for a while, and I was really very unhappy with this point. It was sometimes working, sometimes not. It was not concluent. Later, I discovered from Jeffrey Ewan, and he said, but pericardium, basically, it's the quiet the Shen. To quiet Shen, you need blood. If the blood is deficient, points that quiet Shen don't work. So pericard 6, pericard 7 are not functioning if the blood is deficient. So you have to add points to tonify blood. And there, for example, liver 8 or spleen 6 need to be added to make the point like pericard. If you want to use pericardium points, then make sure that there is enough blood. If not, add 1 or 2 blood tonifying points. Oh, okay. I guess now I need it. I forgot to put it on sleep. Thank you.
Grab it. It's the same model.
Okay, back in business. Now, the next, again, the next slides are just a review of all the patterns. Of course, we find in fire disharmony patterns very commonly chronic insomnia. But as I mentioned before, be aware that any real chronic condition, I always say insomnia and headaches have this thing in common, that they can have you can have several headaches. That's why it's such a complicated thing to treat headaches. Headaches is one of my very personal challenges. I suffered from migraine headaches as a kid, and it was finally, it was treated. When I started studying Chinese medicine, I said, I should try it on myself. So I went to an acupuncturist, and he treated me. After 6 months, I was cured of headaches. I didn't have them anymore. And since then, when the patient comes, they have any problem, okay, it's their problem. But when they say I have headaches, it's personal. I personally get involved. And that's why sometimes it has baffled me that you have done the right diagnosis, the right treatment, and yet you don't get the total cure. You might improve the patient, less intensity, less frequency, but not completely gone. And there I have invariably found another cause behind it. It's common, liver Qi stagnation, liver yang rising with liver blood deficiency, for example. Underlying there might be kidney yin deficiency. And of course, to make everything more exciting, some chronic emotional patterns. So sleep is the same. As an example, I just treated a lady who's a teacher, and she came for insomnia. She says, you know, when I'm teaching, it's terrible because the night before I'm more stressed, I don't sleep, and the next day I'm exhausted. And she's teaching small kids, you know, they're much more challenging. So analyzed her sleep, and it turns out, of course, she has nightmares. And for me, I don't stop at just what nightmares. I want to know the themes and what kind of themes. And the long story short, the themes were indicating a liver dysfunction. They involved a lot of stress, missing opportunities, not getting from A to B. Communication was disrupted. The bus broke down, the train this, I missed the boat, whatever. You see, there is that sort of a theme which comes up, and it was to do with the liver. Examining her, I find bladder 47, the Hunmen, super reactive. Now, for me, this point already is telling me that there is a retained emotion, but also the emotion has to do with Hun, and Hun has to do with not only the general of the army, it has to do with territory. It also has to do with direction in life, the view I have of my life, where I'm going, where I'm not going. If this point is deficient, it's people who have lack of direction. They have lack of limits. People invade them easily. And of course, there's a lot of frustration that sets in. When the point is full and painful, that means there is a retained emotion. Very often it has to do either a lot of frustration, anger, or questions of territory. So I started digging. Since when have you had these? It turns out she's had it for 2 years, the nightmares. What happened 2 years ago? And she laughs and all that. Well, she got married and moved in with her husband. So the story was becoming more clear. And I asked her, and she says, he's a wonderful man, he's very caring, he's this, he's that, you know. Everything, he's perfect. So what is wrong? What is wrong? Now, there came the thing. I said, before that, were you living with your family or were you living alone? She says, I was living alone. I was very proud. I had bought my own flat and all that. There it was. Loss of territory. So slowly, I said, in the new flat, do you have a space of your own? I said, okay, bedroom you share with your husband. Do you have an office? You're a teacher. You need a place to do your preparation. Do you have one? She says, not really. So we came to understand that she was invaded. And because she loved him and he was so caring and so wonderful and all that, She couldn't, make a big manifestation. She was eating it in. It was heating up the liver, manifesting as dreams, which were liver dreams, and especially nightmares. She was living them as nightmares, liver heat, liver fire. So it was very important. Now, I'm not going to solve the territorial problem with needles. Once we have got, and it took 3 sessions to get to that point of discussion, but once she had understood, I said, you need a space. Create a space in your house that is yours, that when you can sort of go back to. Now, these are important points. The Zhang Fu disharmony patterns will orient us, but I'm not counting on the needles or the herbs or whatever to solve all the problems. There are underlying emotional problems that have to be discovered and worked with. And of course, I suppose the rest are all disharmony patterns, which you have them in the handouts with all the points. Okay, these are, again, the same as we saw before. I hear next door they have already finished, so we are going a bit fast. Kidney 1. Actually, lung 11 is a classic for children insomnia. Children, when they want to fall asleep, they hold their thumbs in. And lung 11, never we talk about insomnia in children. It's a fabulous point. Now, I've given you lists of points, and you can see there are many. And obviously, the fire points, a lot of them will have that action, but especially I want to come back to the water points, because fire and water balance is very important, and especially the points on the chest are my favorite. In modern TCM, a lot of body points were put aside for obvious reasons. If you saw that film on Chinese medicine that came out some 15 years ago, it was a long film, and they showed acupuncture done in these clinics, which were maybe this big. And there was a bench all around, and the doctor was sitting on a tiny desk here, and then he was going to the patients and needling them through their clothes. Most of the points were done extremities, and the body points were done through the clothes. And I saw that done the first time. You're totally blown away with these thick jackets. It's cold in northern China in the winter. They just go, they find the points. They're absolutely right on. And obviously, body points were difficult to do. There's a Chinese already traditional prudism about touching the body. All the diagnostic methods they developed was to avoid touching the patients. Japanese didn't have that, so the Japanese methods were much more developed. And then the chest points, I have to stop. Okay, I'll finish. Thank you. Thank you. Thank you.